Breast cancer. Breast cancer can raise a number of questions. What are the risk factors? What are the symptoms? Is it treatable? Can it be prevented? Is it more prevalent in different ethnic groups? In this presentation, I will answer these questions. What is breast cancer? Breast cancer is common. There are over 200,000 cases found in the United States per year. Breast cancer starts when the cells in the breast begin to grow out of control. These cells usually form into a tumor that can be seen through an X-ray or felt as a lump. Most cancer starts at the ducts that carry milk. Most common types of breast cancer are invasive ductal carcinoma and invasive lobular carcinoma. Risk and preventions. There are many preventions that a woman can do to lower her risk of breast cancer. However, there are also risks that cannot be controlled. Let's start with the risks that you cannot control. Just being a woman automatically puts you at risk for breast cancer. Age can also be another risk factor. As you get older, your risk of breast cancer increases. 2 out of 3 women over the age of 55 are found with breast cancer. Family history can also play a role in your risk of breast cancer. Women who have relatives who have been diagnosed with breast cancer have a higher risk of developing it. Those with immediate relatives, such as a mother or sister diagnosed with breast cancer, have double the risk of others. 5 to 10% of breast cancer is caused by genetics. Now let's talk about risks that you can control. Lack of exercise can be a risk to breast cancer. Exercising regularly, about 4 to 7 hours weekly, can lower your risk. Being overweight can also higher your risk, so eating healthy and maintaining a healthy weight, especially after menopause, is highly recommended. Drinking alcohol consistently can also put you at risk. It's recommended to only drink in moderation and to also avoid any chest radiation and smoking as well. Symptoms. Symptoms require a medical diagnosis. Some women can show no symptoms at all. It is important to have regular screenings with your doctor in order to prevent worry, because symptoms are not always visible. It is best to get a professional physical examination or imaging test, such as a mammogram. Any changes in the breast or nipples at all can be a strong indication of breast cancer, such as nipple tenderness or a lump or thickening in or near the breast or underarm area. A change in the skin texture or enlargement of the pores in the skin of the breast can also be an indication. Any unexplained change in the size or shape of the breast, any dimpling anywhere near the breast, unexplained swelling, shrinkage, or asymmetry of the breast can also be a symptom. Nipples that turn slightly inward or inverted are also a symptom. Discharge from the nipple, particularly clear or bloody, are also symptoms of breast cancer. Treatment. It is important to discuss all treatment options, including the goal and possible side effects of the treatment. Getting a second opinion may also be helpful in choosing what treatment is best for you. Treatment depends on the stage of the breast cancer. Local treatments are usually used at earlier stages. They treat the tumor without affecting the rest of the body. These include surgery and radiation therapy. Systemic treatments can be given through the mouth or directly through the bloodstream. They can reach the cancer anywhere in the body. Most women with breast cancer will have some type of surgery to remove the tumor. Depending on the stage of the cancer, you may need other treatments either before or after the surgery, in some cases both. Another option is a clinical trial, which are carefully controlled studies, approved research by some doctors that can be a potential to improving standard treatments. It is important to remember that the standard treatments today were once clinical trials. Incidence and prevalence. 12% of women will develop invasive breast cancer in the United States. Besides skin cancer, breast cancer is the most common diagnosed cancer among all American women. 85% of women who develop breast cancer have no family history of breast cancer at all. These occur to genetic mutations that happen as a result of aging process and life in general. Studies have shown that African American women are more likely to develop breast cancer than any other women. Asian, Hispanic, and Native American women have the lowest risk of receiving breast cancer. Breast cancer can be extremely unpredictable and based on a number of factors. It is important to stay informed on all of the risks and preventions. I hope this presentation was able to answer all of your questions on breast cancer. Thank you for your time. References that were used in the presentation will be listed below.